The IUD stands for intrauterine device and is used as a form of birth control. It can also be used in the minimization of menstrual bleeding and pains that are experienced during a woman's period. It also aids in the prevention of endometrial cancer. These factors often differ from already pre-existing forms of birth control, including the pill, where the pill can often make a woman gain weight, whereas an IUD doesn't have that same effect. The IUD works by inserting it into the uterus through the cervix. There are currently two types that are used in common practices, the copper IUD and the hormonal IUD. The hormonal IUD uses progesterone as a hormone to be released into the reproductive system. In this, progesterone causes a buildup of mucus around the cervix, in which this disallows any sperm from entering, whereas the copper IUD works by having copper wrapped around the stem, which aids in depleting sperm motility and the survival of the egg. The hormonal IUD has proved to have a 99.8% effectiveness rate, whereas copper is 99.2% effective only. A few disadvantages may arise, such as the IUD may be expelled from the uterus without knowledge, especially during menstruation, as well as an infection may occur post-insertion. The hormonal IUD has specific disadvantages, including irregular bleeding 3 to 5 months post-insertion, as well as vaginal dryness and acne. The copper IUD, however, can cause a heavier and more painful menstruating period.
With the IUD's effectiveness as a medical device, it has significantly changed in its history, with many advancements made as technology has improved and new materials have been used. This has led to a long history dating nearly 100 years ago when the first model was implanted into a human. Though the first form of these devices were from many centuries ago, where Middle Easterns placed small stones in camels to prevent pregnancy during their caravans on long trips. The first human implantable IUD device was first noted by Polish-German gynecologist Dr. Richard Richter, who had used silkworm guts to create a ring that was inserted into the uterus, which can be removed later by pulling the thread with tweezers. Later in the 1920s, another German scientist named Ernest Grafenberg had introduced a similar model, where it is a silkworm gut ring, but instead had wound the ring with silver wire in order to locate the device using X-rays. The silver, however, caused gingival argyrosis, turning the gums blue and black, and so resorted to using a German silver, which is a mixture of alloys primarily made up of copper. Shortly after World War II, Dr. Mary Houghton had found that using silkworm guts covered in a gelatin capsule and placing it into the urethra resulted in the gelatin liquefying and spreading, leading to a further drop in pregnancy rates to 1.1%. With many patients during the IUD's early development suffering from infections, they discovered it was due to the tails in the IUDs, but removing the tails made it harder to remove the device, leading to different shaped designs being developed. Dr. Jack Lippis in 1962 created the Lippis loop, and using an inserter tube, it was simple, easy to insert, and cheap to produce, leading to it being the baseline design for years to come. In the late 60s, however, Dr. Howard Tatum designed a T-shaped IUD, which is today's standard for the device, made of plastic with a copper wire attached to the horn of the uterus to increase effectiveness, leading to further designs being approved by the FDA. With the T-shape being the accepted model, small improvements were made, which led to the Paragard being the widely accepted device, made completely of intraterine copper, and can last for up to 10 years in the uterus before needing removal. Hormonal IUDs were also invented at this time, where the cervix would be covered in mucus to prevent sperm from entering. This design had led to issues in the past, where lawsuits were involved when company Bayer AG's design could pierce the uterus, although recently, a new hormonal IUD by Bayer has been proven to be safe and approved by the FDA.
It is noted that devices and materials intended for clinical applications, such as medical and implant devices, should be evaluated to determine their biocompatibility in physiological systems. Our researchers suggested that women think about contraception in the context of each separate relationship, and not as a single long-term individual plan. We further found that there are several reasons why women might be disinterested in the uses of IUDs. This can be costs, lack of understanding of how they work, limited discussions with their healthcare professionals, and women's preferences not being considered when the IUDs are being manufactured. In a survey of women obtaining emergency contraception, it was found that one-third of emergency contraception users were planning for long-term, highly effective methods of contraception. However, very small portion of these emergency contraception users were interested in the IUD. This was related to costs, which were up to $1,000 in some cases, the availability and how to use it, and also, will this solution be right for them in the long term? In an analysis by Anu Gomez and Bridget Freihardt in 2017, we found that many women actually had a clear sense of their contraceptive preferences. However, frequently this did not align with the IUD. So, as we continue to remove barriers to access the IUD, it is critical that patient-centered counseling is utilized to support women in matching the best option for them in terms of their preferences. Thus, we consider that in the future the individual preferences are not only going to be considered, but also will be centered around the counseling with the healthcare professionals, which will allow the women to better understand these IUDs, but also as emergency contraception and for some long-term solutions. Extensive research has also been done on finding materials that are best to use for the IUDs, an example of which is using a low-density polyethylene nanocomposite material for the IUD devices. This not only has very high biocompatibility, but it's very biologically safe and can be used as a novel contraceptive device in the future.